Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. Patients are more likely to accept a no to a specific request for medication if their doctor remains sympathetic to their point of view, according to research published in the Archives of Internal Medicine. Here are some tips to help you prepare for a doctor's visit. Write down any questions you want to ask. Be prepared to list all the medications, vitamins, or supplements you are taking. Write down all the information, advice, and instructions your doctor gives you. Researchers from the University of California, Davis in Sacramento analyzed audio transcripts of visits made between patients and physicians in which the patient requested an antidepressant medication and the physician denied the request. These patients were actually insured middle-aged women who were trained to report symptoms of insomnia, fatigue, and either low back strain or carpal tunnel syndrome, and then to request an antidepressant drug, even though these symptoms are not a clear sign of the presence of depression. Among 199 requests for antidepressants among the women posing as patients, the requests were denied 44% of the time. Overall, 63% of the physicians denied the request by discussing with the women why they were requesting these drugs, referring them to a mental health professional, or offering an alternate diagnosis. Nearly one-third of physicians took a biomedical approach, such as ordering tests or prescribing sleeping aids. Another 6% simply refused the request. Patients were most satisfied when the visits with the physician took an approach that relied on their point of view. We had a chance to speak with Dr. Deborah Paterniti, one of the investigators of this study, who offered some further insight.
One thing I would tell patients is that during visits with their doctors are facing competing demands. And some patients might come in for an office visit with multiple things that they want to talk about. One of those things being a request for a medication or procedure or a referral. And it would be in their best interest, given the findings from our study, it would probably be in their best interest to talk with their doctor about that request early in the visit and to try to explore with their doctor some of the reasons why they might be making the request. In our study, we found that patients whose physicians actually asked them about their motivations for or their reasons for the request had better rates of satisfaction, even when the doctor said no to what they were asking about.
Today's research offers strategies for physicians not to bow to pressure from their patients to prescribe a treatment that might not be the best option for them. For Insider Medicine in Depth, I'm Dr. Susan Sharma.